Hello, this is Dr. Brian McDonough. Welcome to the Dr. Brian McDonough Show. I haven't talked about COVID for quite some time, and that's a good thing. We're starting to realize we can live with it, not just a new normal, but a normal. We can't forget it. We need to respect it. We need to understand it, but it is just part of our lives like everything else. Of course, it wasn't that way 4 years ago when we were first learning about it. The very first podcast of some 500 that we did in audio and video that are still out there was on February 29th of 2020. And I had a chance to listen to it at this 4 year mark. And I thought it's interesting about what we didn't know and yet what we knew. It's an interesting look back, but more importantly, it also shows us how far we have come. Today, February 29th, we had a situation where the president has spoken. Mayor Bloomberg is making a 3-minute video talking about his opinions. Government leaders are speaking. It seems because we have so many media outlets, all sorts of people are speaking. Now, I tend to be a big believer in people from the NIH, the CDC, and those who are involved in this every day. I understand that politicians need to get in front of these things. It's part of their leadership. It's also part of how they get votes and they do what they do. I'm an apolitical person. I'm really concerned about coronavirus, which doesn't care if you're Democrat, you're Republican, you're a citizen, you're not a citizen, if you're from the United States or you're not. I think it's pretty clear. So what we need to do is talk about basic information. So I'm going to start with something very simple today, and that is what can you do right now for you and your family if you're in the United States in a normal community, or if you're in an area that is in the part of the world that is not affected right now by coronavirus. What I suggest is this. You should be washing your hands on a regular basis. Make sure you wash them consistently, 20 seconds or so. In addition to that, what you want to do is you don't want to be putting your hands in your mouth or your eyes. You don't want to touch your face as much as you possibly can, because that's how you can ingest all sorts of pathogens, not just this coronavirus, but all sorts of things. This is basic hygiene that we use in the hospitals and we recommend for our patients, but certainly for all healthcare providers. Start doing that right now. The second thing I'm really pushing for is that we have a great supply of masks, and I understand the government is now starting to spend the money for that. I think that's really important. But what do you do with a mask? You really don't need to be wearing a mask when you're going out in public if you're healthy. You need to be wearing a mask if you're in an area where you're going to have close contact with someone who has coronavirus. If you're a healthcare worker, you're going into a hospital, that sort of thing. Or more importantly, you want to wear a mask if you are someone who has of an infection, especially if you think you might have coronavirus. You wear the mask to protect those around you. In addition to that, let's say you think you have coronavirus. What you do is you call your physician. I would do that first rather than show up in the emergency room or go to an office. Now, obviously, if you are someone who has let things go and you've got respiratory issues, you got to get in when you got to get in. We all understand that in healthcare. And there's a lot of other conditions besides coronavirus we worry about. So I don't want to ever deter anyone from coming in. But if you're coughing and sneezing, those sort of things, and you're just wondering what you have, it's always easy just to call your physician and they'll triage. You know how they do that. They'll talk to you. They'll answer your questions. So use the same common sense you normally do, but be smart. Think about maybe spreading things to others and the fact you don't want to. They're very important points. These are very simple points, and that's what I want to do. I want to present points like this in an easily understandable way. But this is an opportunity not to talk in 10 or 15-second sound bites. That's fine. But this is an opportunity to speak at length and really for people who are interested in this.